Today we're talking about the CSH Framework to work up sleep issues with patients in your practice. And this is a framework that I use every single day with patients in my practice when they're struggling with sleep. And I've been using this for over a decade as a sleep doctor, as an integrative psychiatrist, and it's really helpful to break down sleep issues so you can better assess what's going on with your patient and better implement a treatment plan. So let's look at this today. And before we jump in, I'd like to invite you to like this video if this type of information is helpful for you, and also to subscribe to this channel. Doing so helps to feed the YouTube algorithm. So for a small channel like mine, this helps to get this type of information out to more people. And a quick disclaimer, the information that I'm presenting is information only and is not medical advice. Okay, why do you need a framework? Well, I love frameworks because it helps you to remember information and it helps you to systematically work through a clinical scenario with your patients. When you have a patient coming to you with sleep issues or anxiety or depression or something else, it's really helpful to have a system to work through to make sure you don't miss anything, to help you think through the issues. You know, in med school we use so many mnemonics, right, to remember information, like the Socrates mnemonic when working up pain, for example. So a framework is going to help both you and your patient think through what's going on, and it's going to help you come up with a step-by-step treatment plan. Now, of course, a framework is a simple way to kind of get started, but it's a great way to peel back the layers with complex issues. This framework that I'm teaching you is the CSH framework that I use, and essentially just stands for Circadian Rhythm, Sleep Drive, and Hyperarousal, which are the three main pillars to think about whenever a patient is presenting to you with difficulty sleeping. So I always like to start by assessing their circadian rhythm, simply asking when they get light exposure, what their ambient lighting exposure is like during the day, how much sunlight and natural bright light do they get, what is their environment like in the evening, what is their darkness exposure like. Just asking this can give you a lot of information about what might be going on with the patient's sleep. Of course, you also want to ask them about their sleep schedule, what their sleep schedule is like on work days or school days, and what it's like on weekends, days off, and vacations. If you're seeing and hearing a lot of variability in their sleep schedule, that can give you some clues as to what might be happening with their circadian rhythm. Asking about their daily routines as well, the regularity of their routines, including their sleep schedule, but also including their meal times, their work schedule, are they a shift worker, their school schedule, their exercise routines, if they have kids, what those schedules are like. Getting a really good idea of what this patient's day-to-day activities looks like is going to give you insight into their sleep. The S in the framework stands for sleep drive. This refers to the homeostatic sleep drive. This is going to impact the patient's levels of alertness, their levels of sleepiness. You can ask about what their levels of alertness are like at various points throughout the day. How alert do they feel in the morning when they first wake up? How alert do they feel throughout the day? And what are their levels of sleepiness and alertness like in the evening? Here you can also ask about naps or urges to nap and what that pattern might look like for the patient. And we also want to be asking about caffeine. Of course, caffeine blocks the adenosine receptor. Adenosine is a neurotransmitter that impacts the homeostatic sleep drive. So we can ask about caffeine and the timing of that as well. So these are, again, some simple questions you can ask in this category. If this type of information is helpful for you, then I invite you to get my free CME course called Sleep Medicine Pearls for Outpatient Physicians. You can get that at intrabalance.com/doctors, and you can find the link in the video description below. It's jam-packed with lots of great tools that you can use in your clinical practice, and I like to keep this information really practical so that it's high yield and you can start using it right away. At the time of this recording, it's January 2024. I'll be opening doors to my clinical sleep program for clinicians in a few weeks, so stay tuned for that. If you grab the free course, you'll get on the email list and I'll send you more information about the program if you want to take a deeper dive into practical clinical sleep medicine. The H stands for hyperarousal. This is an important aspect of sleep, and this is a big category because there's lots of different things that can feed into hyperarousal. This includes things like the patient's mood, psychiatric issues, depression, anxiety, trauma, their mindset about sleep. Do they have a lot of anxiety about sleep? Do they have anxiety about their relationship with their bed, with sleep itself? All of these things can feed into hyperarousal and impact the patient's sleep quality. Nervous system activation and hyperarousal can also be caused by other things, including medical issues. Is there a thyroid imbalance, for example, or a cardiac issue? Are there metabolic issues that could be affecting the patient's blood sugar and their cortisol levels, for example? Obstructive sleep apnea and other sleep disorders, like restless leg syndrome, for example, also fall into this category. So this is quite a large category that you want to spend a little bit of time investigating to see what might be going on that's affecting this patient's ability to sleep. All right, so we've looked at how to use the CSH framework to assess your patient's sleep issues. You can also use this framework to create a treatment plan. The way that I like to approach this is to have one intervention for each of the 3 pillars. This is a really nice way to start. It just helps keep things organized, and patients really respond to this. It helps them feel empowered, like there's different elements for them to work on, and it just makes a lot of logical sense to patients. Here's an example. You can start with the circadian rhythm, your C, by introducing daily morning sunshine. For the sleep drive, you might introduce a brisk midday walk to help increase their sleep drive, and then for the hyperarousal piece, you might implement scheduled worry time, which is a really great technique from cognitive behavioral therapy, where patients set aside 5, 10, 15 minutes to write down the things that are swirling around in their mind, especially if they tend to have racing thoughts in the evening or they have difficulty quieting their mind. This is a really nice tool to use. Of course, this is just an example of some interventions that you can use for each of these different pillars in the CSH framework, and these are going to be variable depending on your individual patient. Some clinical pearls here are to really collaborate with your patient on the various pillars in this framework. What are they willing to start with? What resonates with them? Make this a collaborative process, because if your patient doesn't buy in to the treatment plan, they're not going to go very far with it. So collaborate with them, see what they're willing to engage in, and then as they start to make progress, you can layer in more interventions. I don't like to start with too many things all at once because it just gets overwhelming for people and then they end up not doing anything. Start with no more than 3 interventions, 1 per pillar, and then you can introduce more things as they start to make progress and as they start to get a handle on things. Go at the patient's pace. So I often ask patients, how fast or how slow do you want to go with this? Some people will tell me, you know what, I'm ready to go all in. Tell me what to do. I'm really going to work on it and I'm going to go for it 100%. And so then we might start layering in things a little bit more quickly. Whereas other patients will say, this feels really overwhelming. I just want to take it slow. I want to do one thing at a time. And you can start there. What I do tell every patient is that this is going to take time. I use an analogy of turning around a cruise ship. This is not a speedboat where we're just going to turn the wheel a little bit and it's going to go flying in a different direction. This is turning around a big cruise liner. Little incremental changes are going to lead to us going in a completely different direction, but it's not going to happen overnight. It's going to take lots of little changes. It's going to take time, but we need to be consistent, keep moving forward, even when you feel like you're not moving or if you feel like you're going backwards, keep going, focus on these 3 pillars, circadian rhythm, sleep drive, hyperarousal, and then give it time and you will end up going in the right direction. Now, again, throughout all of this, you want to be assessing for other things that could be contributing to sleep issues. Is there a medical issue? Is there a nutritional deficiency or insufficiency? Is there sleep apnea, circadian rhythm disorder, restless leg syndrome, or something else that could be contributing to their sleep problems while you're still working on circadian rhythm, sleep drive, and hyperarousal? And then make sure you introduce the spirit of experimentation into this. There's no one-size-fits-all approach. There are certain things that we do recommend to most people, but you really want to dig in to see what's going on with your individual patient in front of you. Do you already talk to your patients about the circadian rhythm, sleep drive, or hyperarousal? I would love to hear your experiences with this. Any tips or tricks that you have that you find work in your clinical practice, let me know in the comments below. Today, we're talking about the CSH framework to work up sleep issues with patients in your practice. And this is a framework that I use every single day with patients in my practice when they're struggling with sleep. And I've been using this for over a decade as a sleep doctor, as an integrative psychiatrist, and it's really helpful to break down sleep issues.